Let's talk about sleeping and somatic disorders. So, sleep-wake disorders are things that are related to inability or difficulty with sleeping. And these can be attributed to a number of causes. So, these might be in conjunction to things like anxiety, things like depression, things like PTSD. And so, it's important to note if the sleep-wake disorder is something in and of itself or a symptom of something like depression where sleeping too much or sleeping not enough is better explained by that diagnosis. So that being said, we're looking at the sleep-wake disorders having to do with insomnia, which is related to both sleep quality and quantity, hypersomnolence, which is excessive sleepiness despite getting enough sleep, narcolepsy, which is this irrepressible need to fall asleep. And then there are breathing related disorders. So these have to do with not getting enough air, disruptions in breathing, like sleep apnea related to brain issues, or sleep breathing too much potentially while sleeping. So it's disruptions in breathing or not getting enough air during sleep. Looking at circadian rhythm, this has to do with disruption in a sleep cycle, and you're not synced up to a typical day schedule. So we see this a lot in shift work. So we see shift work disorder is the same as circadian rhythm sleep-wake disorder. They've just changed the name. Also, we see this in individuals with a visual impairment or blindness because they don't have those natural indicators of sunlight letting them know when it's time to be awake, when it's time to be asleep. So we have these issues of non-24-hour sleep-wake disorders. Then we have parasomnias. These are abnormal physical or physiological experiences that individuals have during sleep. So non-REM sleep arousal, meaning you're having issues with your REM cycles, having nightmares, having issues with rapid eye movement and behavior of sleep, and restless leg syndrome, which would disrupt your sleep abilities because your legs won't stop moving or you feel a lot of tingling or itchiness in your legs. A lot of these are going to need pretty thorough exploration from a primary care physician, potentially a sleep specialist, to determine if there are underlying physiological causes, especially with things like sleep apnea. There are a lot of potential contributors to this, from various physical diagnoses to environmental issues that need to be checked out. So a lot of these sleep-wake disorders are really something to be aware of because they're interfering with mental health, they're interfering with ability to function, potential indicators of other issues like PTSD, but a lot of these are not going to be things that we're going to treat ourselves in and of themselves in a mental health setting. These are really going to be things that we're going to offer referrals to primary care, to specialists, even psychiatrists potentially to help address some of these things and the underlying physiological needs. Let's get into somatic disorders, which is always really interesting. So illness anxiety disorder was previously known as hypochondriasis. So we talk about being hypochondriacs. This is what we're talking about. And there's this preoccupation with having a serious illness. So I think there's something wrong with me pretty much all the time. This is like WebMD in a person. So when you put in your symptoms, you're always dying. And somatic symptoms, there aren't a lot of somatic symptoms or they're pretty mild. So I cut my finger, my hand is going to fall off from gangrene. Or I have a headache, I must have a brain tumor. So these things are in worry in excess or disproportionate to the physiological symptoms they're experiencing. Um, we saw a lot of this in the wake of COVID. And understandably, because we didn't have a lot of information about COVID. So you have a sniffly nose or you have a cough, you think you're dying because you don't know better. And so we've seen a rise in things like hypochondriasis, particularly with individuals who already had a lot of anxiety. So there's a lot of anxiety related to health and wellness. And this gets in the way of health activities, or they're doing things like potentially avoiding doctors or hospitals. So you either see people in the doctor's office all the time because they think they're dying, or they avoid doctor's offices because they think that there's something so wrong with them no one could help them. And this has to be going on at least 6 months. So as you can imagine, put yourself in the shoes of this client. It's a pretty miserable experience, and it's not necessarily intentional. This is what their brain is telling them. And so there's a lot of anxiety that goes along with this. So for care seeking, they're frequently visiting hospitals for this specifier, or care avoidant, which means that they're not open to seeking medical care. The next is conversion disorder. So this again is involuntary, and it's this really fascinating phenomenon of the body taking mental health and trauma and converting it into physiological somatic symptoms. And when we say somatic, we say things related to the body. So these are sensations within the body. So you see altered motor functioning or sensory functioning, decreased vision, decreased hearing, sometimes to the extreme of decreased ability to move or walk. And there's an example clip in our module that gives an example of a girl who got to the point of literally not being able to walk and having to go through physical therapy because of conversion disorder. We always, of course, want to rule out underlying medical conditions or neurological conditions. Um, this really is somatic. This really is something to do with the way that trauma is interpreted in the brain. So we see weakness, paralysis, abnormal movements, issues with swallowing, issues with speech, to the point sometimes of seizures and loss of sensory information. The body, everything in the world is just too much. And so the body is like, I can't make sense of this mentally. We're going to create a physical symptom to explain it. Acute, this has been going on less than 6 months. Persistent, it's been longer. And finally, we have factitious disorder. This is otherwise known as Munchausen syndrome, or we also call this malingering. This is intentional falsified physiological or psychological symptoms, or doing things to yourself to create injuries and disease so that you need care. So conversion disorder is not intentional. Factitious disorder is intentional. And they present to others as someone who's ill and impaired and injured and needs a lot of care and needs a lot of attention. Different from hypochondriasis, where you actually think you're dying, factitious disorder is manipulation, faking it, right? Malingering is talked about a lot in terms of people exaggerating their symptoms in medical settings. And that's you have to be very careful here because particularly in relation to cultural awareness, we naturally minimize symptoms of individuals with certain identities. And so it's easy to label someone as malingering or exaggerating symptoms when really we should be addressing our own cultural biases that are informing the way that we're interpreting someone's care. So when you're going to use this type of disorder, this diagnostic label, you have to do it very carefully and be very sure of what's going on. And it can take a while to figure that out. I mean, they might be very good at this deception. And they're getting obvious external rewards from it. They're getting attention, they're getting medical care, they might be getting medications that they need. They might be, or medications that they want. They might be getting money, as you see in the clip about Gypsy Rose Blanchard. Her mother was doing this. So that's where we talk about, we used to have this option of a specifier of Munchausen's by proxy or factitious by proxy, meaning that you were inflicting this on someone else. And we do see this with parents intentionally making their children sick or pretending their children are sick for psychological gain or physiological reasons or to get money, a lot of different kinds of reasons. So we don't necessarily have that specifier anymore, but it still fits within the factitious disorder diagnosis. And so the key here is intentional deception to get obvious external rewards. And so we have single episode, meaning you've only done this once, or recurrent, meaning it's happened more than once.